Hello and welcome. Today we're diving deep into a condition that can be uncomfortable and often misunderstood: anal fistulas. We'll explore what they are, why they occur, how they're diagnosed, and what treatment options are available. So, let's get started. An anal fistula is essentially an abnormal tunnel that connects the anal canal to the skin surrounding the anus. What causes these tunnels to form? The most common culprit is an infection of an anal gland. These glands, located inside the anus, sometimes get blocked and infected. This infection can then spread, creating a pocket of pus called an abscess. When the abscess drains, it can leave behind a channel, the fistula, connecting the infected gland inside the anus to an opening on the skin near the anus. Other, less common causes include Crohn's disease, ulcerative colitis diverticulitis, certain sexually transmitted infections, and even trauma to the anal area. In rare instances, anal fistulas can also be caused by cancer or radiation therapy. To understand how an anal fistula develops, it helps to visualize the process. It typically starts with an infected anal gland, as we mentioned. The infection leads to the formation of an abscess. The body's natural defense mechanisms attempt to fight off the infection, but sometimes the pressure from the pus within the abscess forces a pathway, creating a tunnel. This tunnel then connects the infected gland inside the anus to the skin outside. The continuous passage of stool and bacteria through this tunnel perpetuates the inflammation and prevents the fistula from healing on its own. The location of the fistula, its complexity, and its relationship to the anal sphincter muscles determine the treatment approach. While exact numbers are difficult to pinpoint, anal fistulas are more common than you might think. They affect men more often than women, typically between the ages of 30 and 50. Individuals with Crohn's disease are at a significantly higher risk of developing anal fistulas. Factors like obesity, smoking, and a sedentary lifestyle may also increase the likelihood of developing an anal abscess, which can subsequently lead to a fistula. The symptoms of an anal fistula can vary depending on its size and location, but some common signs to watch out for include persistent pain around the anus, especially when sitting, moving, or having a bowel movement. Swelling, redness, and tenderness around the anus are also common. You might notice pus or blood draining from an opening near the anus, which can be accompanied by an unpleasant odor. Some people experience itching or irritation around the anus. Recurrent anal abscesses are another sign that a fistula might be present. In some cases, systemic symptoms like fever, fatigue, and general malaise can occur, especially if the infection is severe. Diagnosing an anal fistula typically involves a thorough physical examination by a doctor, usually a colorectal surgeon. The doctor will visually inspect the area around the anus for any openings or signs of inflammation. A digital rectal exam, where the doctor inserts a gloved finger into the rectum, may be performed to feel for any abnormalities. An anoscope, a small instrument inserted into the anus, allows the doctor to visualize the anal canal. Further investigations may include imaging tests like a fistulogram, which involves injecting dye into the fistula to visualize its path using X-rays, a magnetic resonance imaging (MRI) scan, which provides detailed images of the anal area, or an endoscopic ultrasound, which uses sound waves to create images of the anal canal and surrounding tissues. In some cases, a colonoscopy may be recommended to rule out other conditions such as Crohn's disease. Anal fistulas are often classified based on their relationship to the anal sphincter muscles. These muscles control bowel movements, and the location of the fistula affects the complexity of treatment. The most common classification is Park's classification, which categorizes fistulas as intersphincteric, transsphincteric, suprasphincteric, and extrasphincteric. Intersphincteric fistulas are the simplest, running between the internal and external sphincter muscles. Transsphincteric fistulas pass through both sphincter muscles. Suprasphincteric fistulas travel above the external sphincter muscle, and then through the levator ani muscle. Extrasphincteric fistulas originate outside the sphincter muscles and extend to the anal canal or rectum. The higher the fistula tracks relative to the sphincter muscles, the more complex the surgical approach. Treatment for anal fistulas usually involves surgery. Unfortunately, fistulas rarely heal on their own. The primary goal of surgery is to eliminate the fistula while preserving bowel control. Several surgical options are available, and the choice depends on the type and location of the fistula. A fistulotomy, where the fistula is cut open to allow it to heal from the inside out, is a common procedure for simpler fistulas that don't involve a significant portion of the sphincter muscles. A set-in placement involves inserting a thread or silicone band into the fistula to encourage drainage and healing. This can be a temporary measure before a more definitive surgery or a permanent solution for complex fistulas. LFT, or ligation of the intersphincteric fistula tract, is a technique that aims to close the internal opening of the fistula while preserving the sphincter muscles. Other options include fistula plugs or glue, which are used to seal the fistula tract, and advancement flaps, where healthy tissue is used to cover the internal opening of the fistula. After surgery, pain management, wound care, and antibiotics may be necessary to prevent infection. Unfortunately, there's no guaranteed way to prevent anal fistulas, as they often arise from unpredictable infections. However, several measures can reduce your risk. Maintaining good anal hygiene, including gentle cleansing after bowel movements, is important. Addressing constipation promptly can help prevent straining, which can contribute to anal problems. If you have Crohn's disease or other inflammatory bowel conditions, managing these conditions effectively can reduce your risk. Seeking prompt medical attention for any anal pain, swelling, or drainage can help prevent an abscess from progressing to a fistula. The prognosis for anal fistulas is generally good with appropriate treatment. Most people achieve complete healing after surgery. However, recurrence is possible, particularly with complex fistulas or underlying conditions like Crohn's disease. Maintaining good hygiene and following your doctor's post-operative instructions can improve your chances of a successful outcome. Recent research is focusing on less invasive treatment options, such as stem cell therapy and biological sealants, to improve healing rates and reduce the risk of complications. Scientists are also exploring ways to identify and target the specific bacteria involved in fistula formation to develop more effective antibiotic strategies. As our understanding of anal fistulas continues to evolve, we can expect to see even more innovative and effective treatments in the future. Thank you for joining us on this informative journey. If you suspect you have an anal fistula, please consult a healthcare professional for proper diagnosis and treatment.